Photograph the treatment area. Before starting the treatment, take photos of the area to be treated. Turn on the device and swipe card. Prepare materials before operation. Both the operator and the customer should remove any metal accessories. Wear gloves and disinfect the probes. Covered with a disposable facial towel. Wet the towel with purified water to 2/3 of its surface. Heat the cream on the probes. Spread the cream. Spread the cream evenly over the area to be treated. Step 1. Move around. Choose the dredging mode and adjust the level according to the customer's comfort. When performing meridian dredging, remember to apply slow, deep, and steady movements so that the pulsed energy can penetrate into the meridians and body. Do meridian. Introduction script. Explain the role of the meridians. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. During actual operation, remove clothing. Apply the cream directly on the skin. The dew meridian governs the body's yang energy. If the dew meridian is blocked, yang energy does not ascend properly, leading to insufficient kidney qi. Symptoms may include cold hands and feet, neck, shoulder, waist, and leg pain or deformities. Observe the overall condition of the body, checking if the cervical spine curve is normal, if there is a wealthy package. A common term for fatty deposits at the base of the neck. Place one probe on the Dishui acupoint. If the Baliao area appears darker or feels cold, place one probe on Baliao and use the other probe to move back and forth along the dew meridian 3 to 5 times. Bladder meridian. Introduction script. Explain the role of the meridians. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. The bladder meridian acts as a hub for waste removal. Blockages in this meridian can lead to the accumulation of dampness and cold toxins, causing symptoms such as frequent urination, weak knees and lower back, and enlarged prostate. Observe if the bladder meridian appears slightly elevated compared to the rest of the back, if the skin color is darker, or if the muscles are tense, indicating poor flow. Use dual probes to push along the bladder meridian back and forth 3 to 5 times. Scapula. Introduction script. Explain the role of the meridians. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. The scapula is a reflection zone for the breasts and liver. Blockage in this area can lead to excessive liver fire, resulting in dry and tired eyes, breast nodules, and hyperplasia. During the process, feel the state of the muscles on the scapula to check for nodules or cord-like structures. Ask if there is any sharp pain and identify problem areas. Use dual probes to perform circular movements over the scapula in a heart shape, adjusting the intensity level based on the customer's comfort. Gallbladder meridian. Introduction script. Explain the role of the meridians. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. The gallbladder meridian runs from head to toe. Blockages in this meridian can allow dampness and cold toxins to invade, leading to symptoms such as dizziness, headaches, breast nodules, hyperplasia, and pain or deformity in the waist and legs. Use dual probes to push along both sides of the gallbladder meridian for individuals with thicker fat layers. Apply more inward pressure. Ask if there is any soreness, swelling, pain, or sharp sensations, which indicate blockages or poor flow. Perform this movement back and forth 3 to 5 times. Trapezius muscle. Introduction script. Explain the role of the meridians. Explain the health risks related to poor circulation in this region. Provide a diagnosis and outline how these issues affect the customer. Tensions in the trapezius muscle can disrupt the shoulder curve, causing broad shoulders and a thick back. It can also lead to shoulders and neck pain and stiffness, compressing the cervical nerves and blood vessels, resulting in headaches and migraines. Use stool probes to push the trapezius muscles with slight force, moving back and forth 3 to 5 times. Feel the tension in the muscles. And check for nodules or cord-like structures indicating stagnation. Step 2. Locate. Switch to the stretching mode and adjust the intensity level based on the customer's comfort. Now, we will locate key acupoints for shoulder and neck regulation while identifying problem areas causing discomfort. This targeted approach makes body regulation more effective and efficient. Activate the acupoints: Dizhui, Fengfu, Dazhu, Tianzang, Jianzhen, Zhangliao, Jianjing, Fuqiu. Each acupoint should be targeted for 30 to 60 seconds. Activate the acupoints. Interact with the customer to assess the flow of energy through these points and provide a diagnostic assessment. Introduction script. Explain the role of the meridian. Explain the health risks related to poor circulation in this region and outline how these issues affect the customer. Dizhui, the switch for the body's yang energy, acting as a hub for qi and blood. If Dizhui is blocked, yang energy does not ascend properly, leading to the accumulation of turbid energy, which can result in fatty deposits at the base of the neck. Fengfu, prone to attracting wind pathogens. If Fengfu is blocked, it often leads to dizziness and headaches. Dazhu, the wisdom of bones. If Dazhu is blocked, the cervical spine becomes unstable. Jianzang, a reflection point for the breasts and liver, often associated with pain, indicating poor breast health or stagnation of liver qi. Jianzhen, a junction for qi and blood. If Jianzhen is blocked, shoulder joint pain and shoulder issues follow. Zhangliao. If Zhangliao is blocked, passive arm movements are limited, leading to heaviness in the arms and numbness in the upper arms, potentially causing shoulder problems. Jianjing, one of the deepest and most price-due blockage acupoints. If Jianjing is blocked, soreness, swelling, and pain occurs, disrupting the shoulder curve. Fuqiu enhances passive movement of the neck muscles. If reactions are weak, muscle weakness and fascial tension may lead to cervical issues. Step 3. Clear. Switch to Moxibustion mode and adjust the intensity level based on the customer's comfort. Clear the acupoints: Dizhui, Fengfu, Dazhu, Tianzang, Jianzhen, Zhangliao, Jianjing, Fuqiu. Each acupoint should be targeted for 30 to 60 seconds. Clear the acupoints. Based on the specific conditions of the customer, interact to check if there are still any tender or blocked points. Discuss the potential harms and impacts, guiding them towards appropriate service packages. Step 4. Circle. Switch to pure heat mode with 0 intensity. Perform circular motions over the treatment area for 2 to 3 minutes to soothe the muscles for first-time customers. You can extend this soothing time. Guide the customer to notice the improvements in their body. After the treatment, take photos of the treated areas and compare them with the before photos. Real-life examples of successful treatments. A single device can serve as a performance center for various establishments such as wellness spas, Thai massage parlors, and orthopedic massage clinics.